And that brings us to the last sentence, and this is a good one. I frequently find myself referring to this statement when I'm trying to stress the importance of what we're teaching here in treatment. Without treatment or engagement in recovery activities, addiction is progressive and leads to disability or premature death. Now, nobody wants disability or premature death, and they're saying that that's what's going to happen without treatment or engagement in recovery activities. So we better take a look at exactly what those two things mean. So first of all, treatment. There can be a lot of ambiguity about what proper drug treatment is. Sometimes when I'm doing an assessment, I'll ask, have you ever been in treatment before? And the client might say, yeah, I was in a psych hospital for 10 days last year for a drug overdose. And they don't realize that, no, that's not really drug treatment. That was just a psychiatric stabilization that may have included some groups on substance use. One of the things we're trying to accomplish in this course is to make sure that you have a good understanding of what all goes into effective treatment and making sure that that happens. Like we said earlier, it's not just dropping them off like a car at the repair shop and coming back in a couple weeks and you don't have to worry about it anymore. You want to make sure you're getting the right treatment and that you're providing the best treatment support you can for your loved one. Then there's the second part of that phrase, engagement in recovery activities. That one's sort of easy to gloss over and underestimate how important it is. Sure, it sounds good, makes sense in a discussion like this, but when you think about it, how many people know what that really means or what it should actually look like? As we get into talking about recovery plans, you're going to start hearing about things like aftercare, sober living, 12-step recovery, and other forms of peer-based or social support. These are all going to be important parts of the client's treatment plan. And the one thing they all have in common is driving home the value of continued engagement with other people who have the same condition. This ends up being one of the most effective ways for making sure you're staying on top of managing the condition and avoiding relapse. But I'll say it again, it's really easy to gloss over this one and ultimately blow it off. Not following up with engagement in recovery activities ends up being one of the biggest reasons for the high relapse rates that we often see following treatment.